Okay, we are going to move on to exam 2. I think the material in the exam 2 is very important and very interesting, which is we're going to talk about the human disease related to the bacteria. And we will talk about all those diseases is very common infectious disease in the history caused by different type of the bacteria. So that's what we're going to talk about that. We will have the case studies for you to study and also in the exam. Well, like I said, in the major students, they have to remember the characteristics of all the bacteria, the related disease symptoms, but you guys can use the slides to answer the questions. And I'm also going to provide you some after-class reading material, so you can read through it. It's very useful for you everyday life. And something I will mention, we still have it today, although most of them, we do have a vaccine. So we're going to talk about is respiratory tract causes the pathogen in the respiratory tract. So this is the respiratory tract. So you can see what it looks like. We had an intersection. Usually we call it an epicolytis. It's a soft bone. And remember, when you were young, some kids are very naughty. They are going to be laughing and talking during the lunch in the school. So the teacher will usually be saying, please don't do that. And your parents will say, don't do that. If you're laughing aloud, what happened? The food could go in through the lung area instead of go to the esophagus. Because that's a soft bone, ideally should be closed. If you're laughing and talking during the eating, it's going to open. So, but it is also an intersection between upper respiratory tract and the lower respiratory tract. I also want to say is that there is an area which is tonsil, right here. It's important. That is a reservoir for most of the pathogens. That is the reason some of you, the tonsil is taken out. In our major microbiology lab class, we want them to, using cotton swab, to get isolation, pick the sample from the tonsil area. We want to see what type of the bacteria it is. Sometimes we get isolation of staphylococcus, sometimes we get streptococcus. So that's a tonsil area. Now the bottom, lower respiratory tract, this usually is a lung area. Now, we all have lots of the huge bacteria, which is normally existing in this area. But we often get thickness. What happened is they translocated. Let's say the condition changes from warm to cold, they're going to translocate it. Vice versa. That always causes a problem. So those bacteria, we all call it an opportunistic pathogen. They are looking for opportunity to cause a problem for your body. So that is a respiratory tract. We want to go ahead to talk about these pathogens one by one. So I want to start to talk. The first one is Corynebacteria diphtheria. So first of all, Corynebacteria diphtheria looks like that. What is this one underneath the microscope? It's underneath phase contrast microscope. And do the gram stain. So what's that? What means corner? Genus name and species name. This is a gram-positive Lord's club shape. So what it looks like? Did you feel about it looks like this? Did you feel about it looks like that? It's a diprococcal. It looks like a diprococcal, but dipro-Lord shape. So it's a club shape, like two people stacked together. Some people also say it's like a Chinese characteristic too. Very typical. You can often see like this. Now, if you look carefully, sometimes inside there is a dots there. This dots, we call it inclusion, which is the area to storage of like phosphates, like those chemicals. So very easy, gram-positive, lots, and club shape. Gram reaction, morphology, and arrangement. Okay, what will be cause a problem? This usually happen is for immigrant kids. This sounds like a sensitive topic right now, but based on the CDC data, the high-risk group is immigrant kids came to the United States without vaccination for DTaP. DTaP is a very effective vaccination to prevent this bacteria and prevent this pathogen. But if the kids came to United States with parents, do not have these shots, it will easily to get contaminated with this pathogen. The vaccine D is diphtheria. T is Clostridium tetanus. P is Bordetella pertussis. We're going to talk this real quick. So what happened, you can see, they have a bull neck. You look at that. Then why it will be like that? Swelling of lymph nodes. Some inflammation happened, obviously, and then you also see more obvious is if they go to see a doctor, the kids, and the doctor say, open your mouth, and the kids is crying like, wow, like that, then using the cotton swab touch the tonsil area, you will see the tonsil area is very soft and bleeding and covered with a pseudo membrane. We can say pseudo membrane system, soft pseudo membrane system, greenish. That's a typical symptoms right there for Corynebacterial diphtheria. Diphtheria bacteria is, we say, localized in tonsil. It's not translocated. The bacteria is localized. Pathotoxin, exotoxin will translocated, or we say penetrated, into the other area. This is what I just said. In the United States, this should not be a problem because we have DTaP shots. Look at here, diphtheria, tetanus, pertussis. At 2 months, you need to give a shot. 4 months, 6 months, 1 year old, 15, 18 months, 4 to 6 years old. And I just had one. I haven't done this for 10 years. I just had one with my physician. I do the annual checkup. So usually the baby, when they're born in the United States, and you talk to the family doctor, have set up their immune schedule. But to be honest with our new regulation, this could be changed. And you hear the news. But this is what we have so far for many years. DTaP is very effective to prevent Corynebacterial diphtheria. But what happens here, you see a couple of shots. People don't like, we call it a booster. What this means, multiple shots in different times. The reason is the DTAP is only activate the T cell line. So our immune system, remember, we have two lines, B cell line and T cell line. B cell line will generate antibody. T cell line does not generate antibody. And the memorization capability is usually short. And this vaccine only activates T cell line. So, which means cell-mediated immune is activated, but humoral immune is not activated. So we need a booster, which means you need a shots a couple of times during the life cycle. Okay? This is the toxin, what it looks like. I'll be very briefly here. So when the toxin going to the bacterial cell, is going to the human tissue, let's say, they have two domains. These type of toxin, we call it an AB toxin. So AB toxin has two parts. We call it two domains. The OA domain, usually the toxin domain. Well, toxin domain, of course, it's causes inflammation. The B domain, we call transmembrane domain. This usually causes bleeding. So that's why you looks like here, you see the pseudomembrane system is, the tonsil is like a soft and easy to bleeding. So when they go to the human tissue, they generate in the cell. You can understand it's like a circle. And it's a low pH environment, pH 5. pH 7 is neutral, this is low pH. And then they separated. The B domain goes back to cause bleeding. The A domain will cause toxin. How they do? Inhibit protein synthesis. So that's how they work. It's an AB toxin. Lots of the pathogen, their toxin is the AB toxin. Now, how they got the diphtheria toxin? How it generated? There are lots of theory talk about that. One of the theory what they talk is called lysogeny conversion. So they think about a long time ago. There is a phage called a beta phage. This phage carry on the gene for the toxin, diphtheria toxin. Let's say the sequencing is like this. And I have a bacterial cell, looks like that, the chromosome. And this toxin find a bacteria, the phage find a bacteria. Remember, phage is looks like this. They could go ahead to invade a bacteria. They use the bacterial material to do the biosynthesis of their own material. They couldn't lysis bacteria, which is killing bacteria. But at the same time, they also could put their own genomic information go to the bacteria. So let's say that beta phage is carrying on diphtheria toxin, and then certain gene segments go into the chromosome of the bacterial cell. The bacterial cell becomes toxicated. That's what's called the bacteria becomes carrying diphtheria toxin. So this terminology to explain it is called lysogeny conversion. That is what the toxin comes from. Now, what we should do, if you have type of the symptoms, of course we need to use antibiotics. There is no question about that. But at the same time, we also need to use antitoxin because there's a diphtheria toxin. So antibiotics and antitoxin has to be using at the same time because antitoxin could neutralize the diphtheria toxin. Okay, how we do it? We talk about the bacteria. At the end of the day, we still need to get isolation. But diphtheria bacteria, Corynebacterial diphtheria is not that easy. It's not like E. coli to grow. Because it's an important human infectious disease pathogen, if it's happened, it's need to report to CDC. So usually the physician will have to get you sample. Then we'll be doing, transport media. The transport media called cirrhosis blood agar. And on the cirrhosis blood agar, you will see, system blood agar, blood agar. You will see black colony. And when you see the black colony, you need to re-isolate, go to a transport medium. That's called regular transport medium. And then send to CDC to do the confirmation test. That's what we finally to get a determination of the bacterial culture. So that's a story for diphtheria. In the exam, we'll have a case study to talk about that. Then we will let you determine which pathogen it causes. Okay, so then we started from Corynebacterial diphtheria. The next one we want to talk about is meningitis. This is a very common pathogen. The common symptoms caused by bacterial infections in the United States. We call meningitis. So what is that? Everybody knows. It's a little bit related to the brain system. So meningitis. Meningitis is usually the inflammation between brain cell membrane system and cerebral spinal fluid, spinal cord. But we get the sample is called spinal fluid. So what means inflammation? Think about you sometimes feeling hurt. It looks like red. It's swelling. That's what the symptom looks like. Now, meningitis, there are lots of the symptoms related to that. Of course, people become drowsy, less energy, sleepy. But often the time, it is scared to the light, and also difficult to speak sometimes, difficult to swallowing, and we call it lethargy. Very interesting. They have a very typical symptom people will ignore. It's called tough neck. People think it's a muscle problem, but it's not. It's a meningitis. Now, by the way, I forgot to mention, Diphtheria toxin also could cause neurological symptoms. Difficult to speak, difficult swallowing. Sometimes you get a double vision even. Okay. So that's a meningitis. Meningitis related to the pathogen. It's age dependent. So lots of the bacteria will cause meningitis. There is a certain age group will be sensitive to those pathogens. If you are 0 to 2 months, which is newborn baby, cause meningitis is GBS. What is that? Group B, Streptococcus. If you are 2 months to 5-year-old, HIV. Not HIV, HIV. Type B, Haemophilus influenza. We had a vaccine for that. 5-year to 40-year-old. That means all of you with this group. The target pathogen for meningitis is Neisseria meningitis. We'll talk about this. Older people, more than 40 years old, is Streptococcus pneumonia. So looks like the name causes pneumonia, but unfortunately it will cause meningitis. So the age group have their specific risk pathogens for that. Okay. Now we want to talk about what's going to happen. What's the symptoms they will. Now you can see they transmitted by respiratory droplets. The symptoms pretty much like vomiting if it's severe headache, or obviously lethargy, confusion, tough neckness, and maybe fatal. We know that. Okay, we want to talk each of these one by one. Let's first talk about the Haemophilus influenza. This is a huge one we want to talk about, and it's very interesting. So, Haemophilus influenza I just write H dot and the influenza. So, looks like you have a genome name, species name is influenza. So people say this maybe come from influenza. It's not a meningitis. Yes, at the very beginning, it's related to the influenza. It's like a severe flu. People get isolates from there. But later on they find that this pathogen will cause meningitis. So what did it talk about? What it looks like? Haemophilus influenza, it is a gram-negative, short coccal bacillus. Which means it looks like a cocktail, it looks like a bacillus, so we say it's a coccal bacillus. This pathogen is a fastidious bacteria. So what is fastidious bacteria? It's very difficult to grow, but ironically it causes a problem. How difficult it is? So we talk about the bacteria agar. We mentioned about blood agar. We mentioned about Macanthi agar. And I also joked about there is a bacteria agar for fastidious bacteria is chocolate agar, which is no chocolate there. That is blood agar heated at 60, 70 degrees Celsius turns brownish. So, how fastidious it is. In the clinical area, we talk about bacteria agar. We have basically three, which is macanthi agar. We had a blood agar, and we had a chocolate agar. And the Haemophilus influenza did not grow on macanthi agar, which means you use macanthi agar, you cannot determine it's lactose fermentation positive or negative. It does not grow on blood agar. It only grows on chocolate agar. So very picky. That's why we say it's a fastidious bacteria. You can see here is a chocolate agar. It grows very well, single colonnaded. Second thing is that people has been done research using a general TSA agar. They find this bacteria cannot just simply grow there. They need two ingredients, which is X and V factor. So what happened is that they put X factor there, and V factor there, and X and the V. They find that they didn't grow here. They didn't grow here. They growed only here. Now what is X and V? X is hemi, V is NAD. That is nicotinic adenine dinucleotides, which is an electron carrier. So very picky. But then when the research they going on, so it is so important. The people wants to know more. They find it's very interesting. If I have a blood agar, that's a blood agar. Okay, completely red, you see it. I'm growing streptococcus, a staphylococcus. Let's say ours. We're going to mention this. And then I also grow Haemophilus influenza. I find it will grow. It grows like that. We call this is satellite phenomenon. Looks like a satellite dots there, surrounded the Staphylococcus aureus. Why? Staphylococcus aureus growing on the blood agar will create NAD, nicotinic adenine dinucleotides, and the blood agar has heming there. Heming is one of the components for the blood cell. So you can see, very interesting what they grow. But we know that Haemophilus influenza, in the history, it's severe symptoms. Lots of kids are dead because of that, before the vaccine comes out. Haemophilus influenza causes meningitis. The HIV meningitis is the #1 childhood disease in the United States in the history, before the vaccine comes out. You can see it kills 3 million worldwide. But once the vaccine could reduce to one among the hundreds of, one out of 100,000, so severely decreased the pathogens, the symptoms. Okay, so that's Haemophilus influenza. Neisseria meningitis. This is the second one we want to talk about. A little different. We see Neisseria meningitis. Neisseria meningitis, pretty obvious. Look at those pictures. You have a white blood cell surrounded by Those colony looks like this. So what we call gram-negative rods. Sometimes we say coccobacillus. Coffee bean shape. Looks like a coffee bean. Is that right? Gram-negative, coffee bean shaped rods. We say coccobacillus is Neisseria meningitis, right there. Very typical. If you're under the microscope, you see something like that. Some people have tough neck, like that. Neisseria meningitis. So, in the United States, the serotype is ABCYW135. There is a story behind it. The type B responsible for 60% of the case in the United States. We talked about use vaccine can be effectively to prevent those infectious disease. However, in the long term, from 1980s to 2010, we had the vaccine can only cover ACY and W135. The vaccine by the time is ACY W135 can be covered. So 40% protection impacts. There is a long debate about that, whether we should do, because 60% is not protected. So I remember by the time, because undergraduate is a risk for this one. In Connecticut, in California, some university want students to have a vaccine before they can register for the classes. They can live in the dorm. Some states do not have that. Later on, after 2010, we get the isolates, the structure from the Neisseria meningitis. We get a new vaccine called the cover the type B. The name called Menuming. That's very late. In the recent 15 years, that 60% get covered. So the vaccine what we have right now, MPSV4, MCV4 can cover all these serotypes, but people worked really hard to get those successful. Okay? Neisseria meningitis has a very typical symptom, is tough neck. And the risk group is undergraduates. So if you go to the crowded area, you go to the library, well, not very crowded at WVU, you go to the bar, in some of large cities like that. Then you came back, some people feeling the tough neck, then they will say, okay, just a muscle injury, okay, I'm going to take a break. They take 1 day break, they may not feeling very well. They take a second day, maybe after 72 hours, they're not very well. Later on, if they go to see a doctor very late, you're very weak. Because the diagnosis also took time. They can only do is get you cerebral spinal fluid and then to see the passage, whether you have a coffee bean shaped diprococci. If you have it, which is Neisseria meningitis. So just want to tell you, if you're feeling about a tough neck, sometimes be careful about that. It could be the meningitis. Okay, Bodoteria pertussis. What is this? What is this one? We already talked about this. Just a minute ago, we talked about DTAP. Diphtheria is covered. Clostridium tetanus is covered. Bordetella pertussis is here. What is the symptoms for Bordetella pertussis? It's usually for 100-day-old newborn. They had whooping cough. What is a whooping cough? Is cough, 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 the roar like that. Which means productive cough with respiratory gasp. Like there's some gas in the upper respiratory tract. Typically for a 100-day newborn baby. So this is also in some country, we call a 100-day cough. Here we call it whooping cough. The pathogen is Bordetella pertussis. It's very similar to Corynebacterial diphtheria. It's a coccobacillus. It's AB toxin. But the diagnosis is very interesting. Okay, we want to talk about that. How you do the diagnosis? We had a baby there, let's say. He's coughing. We want to get a sample. How we do? We're using a swab. Go to the nose. That swab is not a typical cotton swab. Because the research has been showing if you're using a cotton swab, it's not very successful to get isolates. That swab, the material is very special. We call it a Dacron swab. A special material. Okay, we have a Dacron swab. We're going to go into the nose. But how deep is supposed to be? We need to measure the distance between the nose and the earlobe. How depth? Half distance between nose and earlobe. We're going to go in. To the Dacron swab, get the sample. We need to transfer into earlobe transport medium. Go into reference lab. I'm guessing, I'm not very sure. I used to work at Kentucky. The reference lab in this area should be at Lexington, where the University of Kentucky located. Some of our students go to the medical school or dental school or veterinary school. Go to the reference lab at Lexington, Kentucky. That's called the earlobe transport media. They can do a final identification. Most of the time, they're using PCR methods, polymerase chain reaction method, to do a rapid testing to see the toxin. Okay, that is Bordetella pertussis. We have slides for that to talk about. Nasopharyngeal swab, that's called, but it's a Dacron swab. It's not general cotton swab. And we're using a PCR method so we can get the results. Remember this? We just talked. I said it's a very important slide. Using blood agar based on their hemolytic, which means whether they can completely lysis blood cell or incompletely lysis blood cell, we differentiate them into three categories, which is alpha hemolytic, beta hemolytic, and gamma hemolytic. Gamma hemolytic doesn't list it because nothing happens. Alpha hemolytic, Streptococcus pneumoniae, incomplete hemolytic, dark green colony. Beta hemolytic, Streptococcus pyogenes, which is transparent zone there. Okay, we want to talk about these. This goes to our next big topic. Two big topics, honestly, not really one. We want to talk about the Streptococcus followed by Staphylococcus. So let's talk about number one, Streptococcus pneumoniae. Streptococcus pneumoniae. When we talk about all these pathogens, three important things from Gram stain. Gram reaction, morphology, and arrangement. This is gram positive. Coccell, diprococcell. Looks like that. Surrounded with capsule. So how we determine it? Remember, we're using the negative stain, or we can do capsule stain. Capsule stain can be done by negative stain. We stain the background, and then the capsule showed up. So we had a picture in our previous slides. That's Streptococcus pneumoniae. Streptococcus pneumoniae, of course, will cause pneumonia. This is already tells you. This is called number one cap. Number one, community acquired pneumonia in the United States. What are the symptoms? And it's responsible for 80%. Okay. There are all the other passages for the next remaining 20%. What are the symptoms? Cough, fever, chest pain. Very typical for pneumonia when you have it. Okay, this becomes a little complicated. So we try to get the isolation of Streptococcus pneumoniae. Okay, let's say you're sick. You're sneezing, your chest pain, your fever, more than 100.4 degree Fahrenheit, you have a fever, technically. So you go to see a doctor. Doctor want to get you isolates. But what happened? The cotton swab go to your oral cavity, more or less going to touch some of the bacteria there. It's also Streptococcus. We call Viridin strep, which means you can understand it's a various different type of the Streptococcus. For example, Streptococcus bovis, Streptococcus mutans, lots of. And we wanted to do is Streptococcus pneumoniae. Then how are we going to do? We're using a blood agar. We split the blood agar onto two parts. We put a disc there. The disc is called a P disc. Now we put a disc there, this disc containing antimicrobials, which is called opticant. And what we find is very interesting. We find that you can see Streptococcus pneumoniae is susceptible to opticant, which means you see transparent zone. So which means the P. disc can kill it. But how about the Viridam streptococcus? They survived, they surrounded. They did very well. So using this P. disc, you could differentiate streptococcus, pneumonia, the one what we want, and all the other bacteria in the teeth, in your oral cavity, very clearly, very easy to determine which one is which. That is called a P. disc. So this is something for streptococcus pneumonia you can see. Allowing rapid multiplication of the bacteria in the alveolar spaces, release pneumolysin, destroy the host cells, cause about blood cells fluid. So how we diagnose? Chest X-ray, gram stem cultivation, testing for metabolic products. What we're going to do? Antibiotic therapy, immunization. I do not think a lot of people do immunization for this one, but we do have it. If you want to see PCV strain, PCV vaccine is data developed, but that is the one, the optional. It's not required to do it. Where it comes from, the vaccine comes from the capsule. They get a capsule of streptococcus pneumonia, they isolate it, get the carbohydrates, polysaccharides, and they become a vaccine. You also need a lot of shots, but this one is not required, but it helps. Usually they recommend you young baby and more than 60 years old adults to do the vaccine for that. But some countries they do, not really being here. They have a vaccine, but it's not very popular or uniform to do. I want to mention one thing. Streptococcus pneumonia is not only pneumonia. It will cause some severe problem. We mentioned the meningitis is one of that. That is the reason when older people has pneumonia, has flu-like symptoms, a couple of days he or she died. This is also the pathogen is very invasive because of the capsule. So streptococcus pneumonia could be invade the blood cell or bloodstream, will cause bacteria, semia, and septicemia. What is the difference between that? Bacteriocemia is bacteria colonize that. Septicemia is not only colonization but also multiplication. The toxin is there, cause the problem. Our blood cell or our bloodstream should be sterilized, which means there's no bacteria there. If you see the bacteria there, that will cause severe problem. The issue what will happen is low down the blood pressure. You don't have enough blood pressure go to the tissues, your organs, very possibly that will cause degradation and decay of the important function of your body. Okay, that's was something important for the streptococcus pneumonia we need to know. Another thing, Viridam streptococcus, you should not be just dismiss that. Very often we see the example in the old days is a 70-year-old grandma go to see a dentist, take out of her wisdom teeth, and she died a couple of days later. Because Viridam streptococcus could cause endocarditis, which is inflammation of heart valves. It could be attacking the heart area. So be very careful. That's why the dental hygiene is important. And also, we will mention later, Streptococcus mutans is a bacteria could use the left sugar in your teeth. Think about your mouth. It's an anaerobic environment, very close to the anaerobic environments. Bacteria can go there. And you have some sugar in the mouth, especially some left food, like rice. So that's a very good resource of the sugar. What are you going to do in the anaerobic environments is fermentation. What they will generate through the fermentation is acid. And the acid will cause the decay of the teeth. Okay? So that's something you want to keep in mind. It is important for the Streptococcus. Okay, we want to mention the next one. Klebsiella pneumonia. So we talk about Streptococcus pneumonia, very severe. 80% of the pneumonia in the United States. We call it a #1 CAP, community-acquired pneumonia. But how about the Klebsiella pneumonia? This one responsible for only 1 to 5% of the pneumonia in the United States. Yes, it will cause pneumonia, but not that severe. But what they will cause? Infant diarrhea, and urinary tract infection. What are the symptoms for urinary tract infection? We call dysuria, which means difficult to pee. So Klebsiella pneumonia, although it causes pneumonia, but it's only 1 to 5%. Basically, it's infant diarrhea and dysuria, urinary tract infection. But when you look at the bacteria growing on the agar plates, it's very interesting. Look at these. That looks like a cheese. It's so sticky. We call it is mucoid colony. Cheese-like. Why? Because it has a heavy capsule. Another thing you can think about. What's the color of that? Is that pink? So why? That's a macaque agar. Why it's pink? Because they use lactose, so it's lactose fermentation positive. And you look at the blood agar, oh, very sticky, heavy. It's like a cheese. So, if people who is infected with Klebsiella pneumonia, what they will have? They'll cough. If they get out of their sputum sample, looks like a currant jelly. Heavy and thick with dead blood cell. Currant jelly does not have much in the United States. You can think about it as your bread jelly. This usually the products in the German and Italy, in the European countries. We have a grape jelly. Think about it same like a grape jelly. It's very heavy, thick cough with some blood cell there. Okay, that's Klebsiella pneumonia. Okay, we are gonna get to this one. Streptococcus pyogenes. That's another topic. Then we are gonna off today. So many pathogens. We want you to be too not overwhelming. Then we'll do some conclusion next class. Streptococcus pyogenes. Streptococcus pyogenes. What is pyo means? Pus. That is dead white blood cell. What is genes names? That's only genetic. Streptococcus pyogenes obviously will cause a severe symptom. Everybody knows strep throat. Looks like this. Strep throat. Tonsil area inflammation. Very severe. But you need to know, when you get to strep throat, it already could be in the later stage. In the primary stage, there are two other things will happen. And the typical age is 5 to 15-year-old kids. Adults don't have this too often. They have first symptoms, strawberry tongue. Your tongue looks like a strawberry. This is a pathogen, very invasive. At the beginning, you see something like that. A swelling in the skin. We call impetigo. A minor inflammation of the skin surface. Then goes to the tissue. Underneath the tissue, you see something like that. Like a bee house. We call it cellulitis. Cellulitis. Then they started to develop strep throat. Strep throat is a later stage. Of course, you have to use antibiotics immediately. So when you go to see a doctor, what they do, they ask, open your mouth, they see the strep throat. They're using a rapid test strip in the nose to see the positive and negative. If it happens, you have to use antibiotics immediately. But the more severe symptom, what we will have, is after recovery. You could have post-strep disease. Is glomerulonephritis and rheumatic fever. What is rheumatic fever? You have a fever with joint pain, with a bone joint pain. What is glomerulonephritis? It's a kidney disease. In your urine sample, you may see protein there. You may see glucose there. Because your kidney membrane filtration system has been damaged. So strep throat, to be honest, is pretty severe because the pathogen is very invasive. They have all kinds of the enzyme to damage it. Last thing before we go, we want to talk about that. Lots of the textbook does not matter about the major or general education. You see often, they will write like Streptococcus pyogenes bracket GAS. Nobody knows, never explained what is that. What is GAS? This is called Rebecca Lansfield Group A Streptococcus. Rebecca Lansfield is a great American microbiologist. In 1930s, she collected lots of the Streptococcus, do a lot of the study in the rabbits, which is antibody antigen precipitation study. And he used his unique methods to do serological typing, including different groups. So right now, we have 3 pathogens which is well known. Group A, Streptococcus pyogenes, cause strep throat. That's why it calls GAS, Group A Streptococcus. Group B is Streptococcus agalactiae. This is called GBS. I just said it's responsible for 2 months to 0 to 2 months newborn baby meningitis. Group D, Enterococcus facilis. This is what they grouped. But we just mentioned about Streptococcus pneumonia. That does not fit any of the Rebecca Lansfield group. Why? They rely on M protein to do the grouping. Streptococcus pneumonia do not have M protein. So they did not, unfortunately, does not belong into any of the Rebecca Lansfield group. So we don't say that, but GRS or GSS, we don't say that. Because they don't have an M protein. You can see the structure of a bacterial cell, a gram-positive bacterial Streptococcus, what it looks like. The M protein on the top is very important because it tells us, is that GAS or GBS or GDS? Okay, that's what we have today. We're going to continue to talk about Streptococcus. Then we're going to move on to Staphylococcus. Then we're going to go move on to a big group, which is Clostridium, next Tuesday. Okay?